Patients often ask, how is prostate cancer diagnosed? And today, most prostate cancers are diagnosed through the PSA, or prostate-specific antigen. This is a blood test that's done in the doctor's office. It's often done by the general practitioner. There are normal values for a person depending upon his age, and if the value is elevated, the doctor may refer him to a urologist who will go further and do a biopsy to obtain a diagnosis of prostate cancer. Fortunately, today, most prostate cancers are diagnosed in an early stage, which means they're diagnosed small before they've had the opportunity to spread, and they're very treatable. There's been some controversy as to who should have a PSA screening or early detection test done. Patients who are healthy and are likely to live for 10 years are good candidates for prostate cancer early detection. In the metropolitan New York area or in central New Jersey where we're located, the average lifespan of a middle-class male is 77 years. But that's really not true. We're able to deliver such good health care that many of our patients live into their mid-80s, if not even into their 90s. So if a patient came to me and he was 85 years old and he was having some difficulty with his urine, or there was a family history of prostate cancer, or he was worried about the PSA test, the prostate-specific antigen, he would be a good person to evaluate further. Many patients ask, what are the symptoms of prostate cancer? And the answer is usually nothing. Prostate cancer is usually asymptomatic unless it's more advanced. Today, because we have the PSA, or prostate-specific antigen, we're able to detect prostate cancers at a very early stage. This is way before they have symptoms. So prostate cancer is something that you have to talk to your primary care doctor about and see if you're a candidate for early detection through the PSA test. When a patient asks me about getting a second opinion, they sometimes are a little embarrassed. They sometimes feel like I'm going to be angry with them, or that I feel that they think I don't know what I'm doing. But that's actually wrong. Most doctors welcome a second opinion. A second opinion is an opportunity to have their work looked over and to make sure they're on the right track. When a patient goes and gets a second opinion, they're often happy to find out that their doctor is treating them the right way. Thank you for choosing St. Peter's.